Hi everyone, this is Yukti Belwal and today I'm in New Vision University of Tbilisi, Georgia. So with me is
Lana Bokuchava. My name is Lana Bokuchava. I'm coordinator of the education process at New Vision University. It's very nice to meet you.
Yeah, so you're looking all the administration of the university?
Yes, for the educational part.
Oh,
That's
okay,
true.
Okay. So today we are here to basically know the facts and facilities about this university for Indian students, because when Indian students decide to go abroad, they have certain questions in their mind. So we are here to ask you those questions to make sure that this university is good for Indian students. Okay. So please tell me something about the university, like when it was founded and everything.
Yes. First of all, the New Vision University, according to the name, it's also seen that we have the new vision and very up-to-date vision of the medical, let's say like that, studies and medical education. This is the one thing. We are very close and we are accredited literally not only in the Europe but also in the US. This is the second thing. The third thing that is important, that in the case of the New Vision University, we have one of the most updated type of the educational process, where we have the most integration of all of the medical subjects in the fundamentals, so basics, and also the clinical ones. Basically, the whole education process is divided into the separate entities, and one of it is a part of the healthy body, where students integratively are studying the whole healthy human body. What is norm? Because if we do not know what is norm, how we can identify what is pathology? So this is the one thing, one of the milestones for the students of the med school. Then step by step we're starting to talk about the part of the pathologies and plus the treatment to the same pathologies, which is also very much integrated. So the word integrated in this case means that we are making and studying different topics from the different perspectives, from the different subjects. So every and each subject literally makes some huge let's like that input into the understanding of particular topic. It will be in the fundamentals or it will be in clinicals. It's the same.
Okay. So the next question which comes in the mind of the student is, okay, the university is fine, so what about the hospitals? So where they have to do their clinical part?
Thank you. That's a good question. That's an important question for the medical students, because hospitals, in our case, we do have our own university hospital. This is the one important part, because we literally have most of our rotations there, in the clinical rotations, where the students have all of the opportunities to study first of all, and to see what does mean the clinic, what does mean really the communication with the patient, and all of the hands-on and hands-off practice. Also, it's important to remember that, again, from our curriculum, which is very integrated, we are making the maximum input into the clinical part, which means that students are literally studying not only directly, let's say, like clinical subjects such as cardiology, such as pulmonology, and so on, so portion of the internal medicine, but also what does it mean the patient and doctor communication, because this is also very much important, not only for the practice itself, but also in the case of any type of the residency programs. The one step to enter to the successful residency program is also the fulfill the knowledge about the practicals. That's true.
Okay. Now let's talk about Bologna process. Am I pronouncing this right?
Bologna, yes.
Bologna. You also say it for Bologna.
Bologna, yes.
But we said Bologna.
Bologna, yeah, because it's literally written like that. But as I remember that in the case of the Latin, the G is not. Yes, they are not pronouncing. Literally, I do believe that everybody could understand what we are talking. Yes. Okay. So in this case, in the case of the Bologna process, first of all, it's the one of the best initiatives in the world that was done. Why? Because different students from the different countries were having the difficulties at the very beginning to, for example, transfer, or their credentials in the different countries were not recognized. And that's why this Bologna process, made it very simple and made the one standard and one level in every type of the education process, and the medicine is also included. As a result, in our case, the New Vision University is also a part of the Bologna process, and in this case, literally the whole of the curriculum and the study process has the high level, which is accredited and recognized by this particular Bologna process. And we are using here comes the new, let's like a terminology, and this is the ECTS, which stands for the credits, also for the educational success, where different types of the subjects are having their own specific credits, which are everywhere recognized, so as the same. So that's why using all of the this particular let's like that tools, literally the New Vision University is one of the highest ranks. Yes. Okay. So literally recognized. That's the main thing that we are using.
As you talked about credits, you know. So MBBS is 360 credits.
Yes.
So here you are making them teach in 5 years the whole of it. So is it sometimes any students cannot clear the whole subject in 5 years? Then what happens? Is it any case like that?
Literally, the thing is that I do believe it's understandable when a student enters to the university, they are taking the obligation first of all to study, which means that when they are taking the subjects, it means that they are already having the obligation to study. That's why most of them are going through and very successfully and so on, because at the very beginning they understand here that med school is something else. Yes, I do believe it's understandable. So sure, in the case of if they and they understand their obligations, as much as possible they are doing their best, and that's why they are literally studying very hard, because I do believe it's understandable. There are the tough examinations sometimes and so on, which need to be covered, and as a result, step by step, because of these obligations and because of this med school, let's like that itself, the med school, a very, very difficult type. Yes, in this case, sure, there can be the cases, but again, it's up to the student. It's up to how do they understand that they are coming to the medical school, and they are dealing literally in the future, and not only in the very, let's like that, long future, literally very close.
Yes.
They are if not from the first semester, but from the second, third semester, they're already entering to the clinics, and they see what does it mean to deal with the real life of the patient.
Yes.
That's the
Tell
point.
me about the teachers and the professors. What kind of professors you have, you know, their qualifications and all.
Thank you. That's also a very nice question, and I do believe it's very much important information. And I will tell you one thing. First of all, again and again, because we are having a high standards and we are recognized literally in the whole world. In this case, we are making it as literally the standards are, which means that we do have full professors who are sure not only the PhD holders, but also it's not just like PhD. It means that all of them are engaged in the process of education and also in the process of the scientific research. This is important. This is one of the milestones, let's say like that, of the medical school. This is the one thing. Second thing, we have the associated professors, which are younger, sure, I do believe it's understandable, have also are engaged in the education process, also are engaged in the in the researchers. This is also important for us. We do have the lecturers who are the PhD students also, and these people are, as you can see, not only are again and again engaged in the education process, but also engaged in research, because PhD without the research is literally impossible. Yes, so that's the one of the most important things that mostly the stuff that we have, I mean the academic stuff, they are either in their PhD or they are associate or full professors, which means that they are well qualified. That's true. They are not only the MDs, that's the main thing. So not only the MDs. Sure, this is the part of the fundamentals. In the case of the clinics, it's literally the same. In this case, we have even let's look at professors who are holding the PhD, again full professors who are holding the PhD in the clinical subjects, who are having their own patients, who are well qualified in the practical part, so in the clinical part very, very deeply. So as you can see, we are making the complete, from fundamentals, from clinicals, or from both of the sides, we are making literally...
They're active in their fields right now.
Sure, that's the main thing. That's the main thing for us, because it means that they are always updated with the new treatment, with any new part of the diagnostic tools and methods and so on. And that's why it is important for us that the clinician, the professors who we have in the clinicals, they are clinicians even right now, and they are practicing. This is literally very much important.
So in a day, how long is the classes? Like how many hours, how many subjects do you cover? The student has to cover?
So it's up to, first of all, the semester. Sure, this is also has some differences. In the case of the first semester, for example, this is literally 4 main subjects that we need to cover, which contains, again, I'm saying that it's an integrative type of the education, and in this case, we do have a body systems and the life sciences, which are integratively containing the part of the anatomy, the physiology aspects. It covers the molecular biology, biochemistry, and the histology aspects together. So literally integratively. And we also have a part of introduction to medicine, and also the research methodologies, which is also a part of the MD. And because the doctors are not only the practitioners, but we are also the researchers, and so it's important.
Okay, so one more question about the related to Indians only, like MCI, Medical Council of India. They take examination of all the students who go abroad and study. So when they come back, they have to appear for this examinations. Are you preparing these students for that?
Again, thank you. It's a very nice question. I do believe very much important for particularly Indian students. Sure, because we understand it's not only just making the MD with a very high standard, but also we realize that students need to write a test. It's also very much important. That's why we do have, and we are also planning, we do have right now, and also planning in the future, more and more, and organizing, we could say, not even the planning, the different types of the tutorials and the specific classes for the MCI tests, particularly because I do believe it's for everybody understandable. One thing, you gather the knowledge, the second thing, how you can implement it. And that's what we want to do. That's what we want our students also to study, not only just gather, but also make it implementation. So sure, this is the one thing. At the same time, I could say here about the USMLE part, because many students,
also,
by the way, yes, they are very much interested in taking the USMLE. So, and same happens for the USMLE, and we are organizing right now several months type of the classes for the USMLE, which covers the step 1 first, and then step by step 2. So in this case, our curriculum of the New Vision University is very much helpful for both of these examinations, because it literally shows and makes let's like that different topics from the let's like a different perspectives from the more clinical parts, because both the MCI and USMLE, even in the first step, which covers the basics, still have much clinicalized questions, let's like and clinically oriented. That's why sure we also preparing this, and we are working on it. So that's why literally in our case, I do believe that the New Vision University would be the best choice for the students.
That's really nice.